Hello everyone, this is Madan. How are you all doing? Since the COVID-19, we all have heard various words. One such word is pandemic. But there are other words that are associated with this. Let us see it in this video. Epidemic, endemic, pandemic. Now we shall see what are the differences between these three. For the past 3 odd years, we are living under the fear of COVID-19. The novel coronavirus pandemic is the perfect model for understanding what exactly a pandemic is. It also helps to know how it impacts life on a global scale. Since the emergence of COVID-19 in 2020, the public has been drowned with information. They are bombarded with new language to understand the virus and the subsequent global public health response. We will uncover the factors that make a pandemic and how it differs from epidemics and when a disease is endemic. What is an epidemic? The Centers for Disease Control and Prevention describes an epidemic as an unexpected increase in the number of disease cases in a specific geographical area. Yellow fever, smallpox, measles and polio are prime examples of epidemics. An epidemic disease doesn't necessarily have to be contagious. West Nile fever and the rapid increase in obesity rates are also considered epidemics. Yes, you heard that correct. People becoming fat is also termed medically as epidemic. Epidemics can refer to a disease or other specific health-related behavior. Similar to obesity, smoking cigarettes can also be categorized as epidemic. Epidemics should have rates that are clearly above the expected occurrence in a community or a region. Now, what is a pandemic? The World Health Organization declares a pandemic when a disease's growth is exponential. Exponential means growing or increasing very rapidly. This means the growth rate skyrockets. Each day, cases grow more than the previous day. When you are declaring something as pandemic, the virus has nothing to do with virology, population immunity, or disease severity. It means a virus covers a wide area affecting several countries and population. So now what does endemic mean? A disease outbreak is endemic when it is consistently present but limited to a particular region. This makes the disease spread and rates predictable. Malaria, for example, is considered endemic in certain countries and regions. Now let us see what are the differences between pandemics and epidemics. The WHO defines pandemics, epidemics and endemic diseases based on a disease's rate of spread. So the difference between an epidemic and a pandemic isn't in the severity of the disease, but the degree to which it has spread. A pandemic cuts across international boundaries as opposed to regional epidemics. This wide geographical reach is what makes pandemic lead to large-scale social disruption, economic loss and general hardship. It's important to note that a once declared epidemic can progress into pandemic status. There is one vital difference between epidemic and pandemic. An epidemic is large, but generally can be contained, that is brought under control faster, or while it spreads, it weakens and it will become smaller. But the pandemic is a different case altogether. It is international and out of control.
Causes of disease outbreaks. Several factors contribute to the outbreak of infectious diseases. Contraction can occur as a result of transmission from people, animals, or even the environment. For example, Weather conditions. For example, whooping cough occurs in spring. It is a serious disease, especially of children, which makes them cough loudly and not be able to breathe easily. Whereas measles tend to appear in the winter season. It is a common infectious disease, especially among children, in which your body feels hot and your skin is covered in small red spots. Exposure to chemicals or radioactive materials. For example, Minamata is a disease contracted after exposure to mercury. The social aftermath of disasters such as storms, earthquakes, and droughts can lead to high disease transmission. A number of environmental factors such as water supply, food, air quality, and sanitation facilities can catalyze the spread of infectious diseases. It is okay if the disease is identified or identifiable. But there are cases where the origins of disease can also be unknown. These kinds of diseases could be caused by a variety of factors, including a new or newly modified pathogen, natural toxins, undetected chemical releases, and radiation overexposure. Now here the field of epidemiology works to trace these unidentified outbreaks to the source in an effort to protect public health and safety. Let us see some notable past pandemics. The current COVID-19 outbreak is not the only disease to have impacted the world on a global scale. Here are just a few examples of past pandemics that have shaped the evolution of outbreaks and human immunity. The Black Death. This happened in the year 1346 AD to 1353 AD. The Black Death caused an estimated death of 25 million people across the world in the 14th century. This was about 2/3 of the population in Europe at the time. Rats traveled on ships and brought fleas and plague with them. According to scientists, the outbreak was caused by a bacteria called Yersinia pestis. This bubonic plague lasted for about 4 years. American plagues. This happened in the 16th century. That is about 500 years ago. A cluster of Eurasian diseases was brought to the Americas by European explorers. Smallpox was one of the chief illnesses of the American plagues. It was so severe and contagious that it contributed to the collapse of the Inca and Aztec civilizations. Some estimates suggest that 90% of the indigenous population in the Western Hemisphere was killed off as a result. Just imagine this. 90% of population was wiped out. Smallpox is an acute contagious disease caused by the variola virus, a member of the orthopox virus family. It was one of the most devastating diseases known to humanity and caused millions of deaths before it was eradicated. It is believed to have existed for at least 3,000 years. Smallpox is estimated to have killed more than 300 million people since 1900 alone. The flu pandemic. This happened between 1889 AD and 1890 AD. New transportation routes made possible in the industrial age made it easier for influenza viruses to spread widely in the United States and beyond. In the span of months, influenza traveled around the globe, with the earliest cases reported in Russia. The virus spread rapidly throughout St. Petersburg in Russia. Then it quickly spread its way through Europe and the rest of the world. An important aspect is that during those times, air travel didn't exist. But it killed nearly 1 million people.
Spanish flu. This happened during 1918 to 1920. Another massive disease outbreak was the influenza pandemic, popularly called the Spanish flu. This viral pandemic began in 1918, immediately following the World War I. Over 50 million deaths were recorded during this outbreak, with the disease lasting only 2 years. The second one is the Asian flu. This happened between 1957 and 1958. The Asian flu pandemic, which was a blend of avian flu viruses, began in China and eventually claimed more than 1 million lives. The CDC notes that the rapidly spreading disease was reported in Singapore in February 1957, in Hong Kong in April 1957, and the coastal cities of the US in the summer of 1957. The total death toll was more than 1.1 million worldwide, with 1,16,000 deaths nationally. AIDS pandemic and epidemic. This started in 1981 and it is continuing still. Since it was first identified, AIDS has claimed an estimated 35 million lives. Scientists believe that HIV, the virus that causes AIDS, is likely to have evolved from a virus found in chimpanzees that was transferred to humans in West Africa in the 1920s. By the late 20th century, the virus made its way around the world. For decades, the disease had no known cure, but medication developed in the 1990s now allows people with the disease to experience a normal lifespan with regular treatment. There is strong historical evidence of how deadly pandemic can be. But don't we all know that history repeats itself? There is a famous quote by Albert Einstein: "Two things are infinite, the universe and human stupidity, and I am not sure about universe." That's what he said. This is what happened in so many parts of the world, and in particular in the United States. I mean, how foolish can they be? They refused to wear masks, refused vaccination, and generally acted stupid, putting millions of people to death. Several years ago, I had good things to say about America, but after their behavior during COVID, the respect towards them has reduced considerably. Now, be safe. Thanks for watching the video till the end. Please like, subscribe, comment, and most importantly, share it widely. Thanks once again. Take care. Bye bye.